Hi, everybody. My name is Tina Bhutani. I'm an associate professor of dermatology at UCSF Medical Center. Today, I'm happy to review the article by Chung et al., looking at the differences in quality of life and psychological outcomes in patients with psoriasis and atopic dermatitis. I thought this was a really interesting article because it is something that we very commonly see in clinic, that working with patients with psoriasis and atopic dermatitis is often quite different. And I think here, Chung et al. Have provided some great framework for that and why that might be. One of the main findings of this paper was that patients with atopic dermatitis might be at greater risk for things like ADHD or conduct disorders, some more behavioral problems, whereas patients with psoriasis are at greater risk for mental health disorders like anxiety and depression. They also found differences in suicidality between these patients. So they found that although both patients with atopic dermatitis and psoriasis were at greater risk for suicidal ideations, actually only the psoriasis patients had a significantly higher risk of actually carrying out a suicidal act. So that was also very interesting. Again, highlighting the fact that psoriasis patients might have more severe mental health disease. Their conclusions are that some of these differences might be due to the age of onset of these different diseases. Patients with atopic dermatitis tend to get their disease earlier in life, before they're able to fully form a sense of self psychologically, and before they're able to vocalize mental health disorders or psychological changes such as depression and anxiety. Whereas psoriasis patients develop their disease much later in life. The disease might be much more impactful because up until that time, they've essentially lived a very normal life. And then all of a sudden they develop this chronic disease. Therefore, it makes sense that they would be more strongly impacted and might have more mental health disorders related to their disease.